Hey guys, just wanted to give you an update on my very eventful afternoon. Funny enough, it's Fall Apart Friday and I'm kind of falling apart emotionally right now. I take LDN or low dose Naltrexone for my fibromyalgia pain and symptoms. I started off trying to manage my symptoms with diet. That took care of, I'd say, at least 50% of my pain and my symptoms. Of course, I have to manage my stress levels, my sleeping, and my pacing. That helps manage my symptoms. But when I was prescribed LDN and got to my dose, for me, it's 3 milligrams, that's helpful. That took care of the rest of my pain, which is pretty phenomenal. I still get fibromyalgia pain if I eat something that I shouldn't, if I'm not managing my stress levels, if I'm not getting a good sleep. So it doesn't keep the pain away, but as long as I'm doing everything I can to manage my symptoms, it manages my pain, which is phenomenal. So it was a struggle to get LDN. I didn't even know what it was, and I couldn't even describe it to you. I know it's like an opioid blocker, but I'm not going to say too much more because I don't know enough off the top of my head to explain exactly how it works. But I know at high doses, it's used for people with addictions to alcohol and drugs. But at low dose, it's used for a lot of things to help manage pain in like chronic fatigue, fibromyalgia. I know it's given to some cancer patients. And they are now prescribing it for people with long COVID symptoms. So there's a lot of benefit to it. I went to an integrated chronic care service clinic in my area, which I had to get a referral from my doctor. And they deal with people who have chronic pain issues, fibromyalgia being one. And when I went through their program, lots of different things, a dietitian and some therapy and pacing, like all the things, they cover all the gamuts that were covered in any of the materials I had been reading, which was great. And LDN was an option to start a prescription there. So I was very hesitant, but I started the prescription and the results were phenomenal. And for me at this dose, there's no side effects, which is great. So before I could be released from that program, because it's not a program you stay in indefinitely, I needed to find a doctor who would prescribe the LDN for me. My GP wouldn't prescribe it for me. She said it was an off-brand use, and she was unwilling to educate herself on it. So that was very concerning to me. But I was able to find, my compounding pharmacy actually knew of a doctor who would prescribe it. So that was great, and he's been prescribing it to me ever since, and I was released from the chronic pain clinic. I found out today I had to call in to renew my prescription, and I found out today that my pain doctor is closing his practice here. So that sent me into a bit of a tailspin because I do not want to be without this medication. And knowing that my doctor won't prescribe it to me, I don't know what options I have. So thankfully this doctor, he said he's able to prescribe it for 6, possibly 9 months, and then that would be what he could do for me, which I appreciated. So I called my compounding pharmacy and left a message to see if they knew of any other doctors who would prescribe LDN that I might be able to get in touch with. I called my doctor's office because I'm going to exhaust all options, and my doctor isn't in all the time, but she does have someone who helps fill in for her patients, so hopefully I can talk to them as well. But their office is closed mid-afternoon on Friday, so I'll have to leave that to Monday to make that call. I have a neurologist, so I called and left a message there. I don't know if that's something in his wheelhouse, but I'm thinking maybe if he deals with patients with MS that he's familiar with LDN, and maybe he can't prescribe it to me, but maybe he knows of a doctor that does prescribe LDN that I might be able to get in touch with. I just want to exhaust all my options because it is a panic for me to think about possibly not having this medication. And then I went on the LDNtrust.org website, and they actually have a list of prescribing physicians. Excuse me. So I just looked across Canada. It's mostly in the States, but they did have Canada and the provinces there. There aren't any in my province, but there were 3 prescribing doctors in 2 other provinces. So I sent them emails explaining my situation and to see if there was anything they could do for out-of-province patients. And there was also a place in Scotland, funny enough, and they, I believe from my reading that they do prescribe it worldwide. I would have to have documentation from my doctor saying that this was the condition I have and provide other documentation. So I just sent them a general email before I booked a consultation to see if it was, you know, something that they could help me with before I booked somebody's time and wasted it. And then, lucky enough, this afternoon I had one of the doctor offices that I had contacted out of province, they emailed me back. So I just wanted to read a little bit here without going into too much detail, but the doctor at that clinic does work with out-of-province patients, but with the understanding there's certain limitations with testing and diagnostics, which I've been diagnosed with fibromyalgia for a number of years now, and I don't need any ongoing testing that wouldn't be beyond blood work that my general doctor could do. They would have to use a pharmacy in their province that could ship to me. So my concern there is I did ask if it was a compounding pharmacy because there are lots of additives and food additives and different foods that I have to avoid or it causes me a fibro flare. And I can book a consultation with this doctor. It would be, you know, in about a month's time. And it would be a video consultation and it would cost $300. So I asked if it could be booked in installments or paid for in installments. She said, unfortunately, no. And I asked if the pharmacy was a compounding pharmacy that the doctor used because of my limitations that way. And I got a response back saying that the doctor would use a compounding pharmacy in their province and they would ship it to me. And if I had any medication information, supplement information, or lab work that I could provide ahead of the appointment, then that would maximize our time during our appointment. So that would be great. And so then I just responded saying that yes, I would like to book a consultation. And asking if there's a cancellation fee, if in 30 days, if I do find somebody in my province or my doctor happens to change her mind, can I get reimbursed or is there a cancellation fee, that kind of thing. So I am anxiously awaiting. So anyway, that's some good news. It's going to hurt the pocketbook a little bit, but I can't be without this medication, and I'll do this in the interim and until I can find somebody in my province. But I'm curious to know anybody else with fibromyalgia out there, if you have heard of LDN, if you are using LDN and what your experience is. Like, do you have any side effects? How does it help your chronic pain or your fibromyalgia? Are you taking it for something different? And what were your challenges in trying to find a prescribing doctor? Was it difficult, or were you able to get the prescription fairly easily? Anyway, that's it for today, guys. Happy Fall Apart Friday.